explain first kung ano nga ba yung measle. Measle is a highly contagious respiratory disease also referred to as rubiola. It is an airborne that spread very easily through cough and sneeze upon infected people, and it can result in severe, sometimes permanent complications, including pneumonia, seizure, brain damage, and even death. So yung measle, it is highly contagious. This means that the infection can spread very easily from person to person. A susceptible person that is exposed to the measle virus has 90% chance of becoming infected. Also, measles spread fast in places where people are not vaccinated. Anyone who is not protected against the measles virus, especially children, are at risk of getting infected. One of the reason din kung bakit mabilis yung pagkalat ng measles is because it is airborne. It means it can spread through air, and it can last in the air for more than 2 hours. So, yung measles virus or mas kilala natin sa Tagalog na tigdas is isa siyang sakit ng mga bata wherein may mga tumutubong rashes na color reddish-brown na nag-uumpisa sa head pababa sa buong katawan. May mga cases din naman na may mga adults na nagkakaroon nito, pero mostly kasi talaga is mga children, yung mga children and babies yung mga nagkakaroon nito. Yung mga nagkakaroon nito is mga children ages 5 years old and above. And sabi nila is hindi daw ito mapanganib. Pero napaka mapanganib nito, especially sa mga bata and sa babies. And according nga sa WHO, yung measles virus is the number one leading causes of morbidity and mortality sa mga bata. And kasi maraming complication yung pwede mong makuha dito, like brain damage, which can cause to paralyze and autism, pamamaga ng lungs, and paghirap sa paghinga. Measles pathogenesis. The primary site of infection is alveolar macrophages or dendritic cells, while the primary viremia is 2 to 3 days after the replication, and the secondary viremia is 5 to 7 days after the exposure. So, in developing countries like the Philippines, measles is a leading cause of childhood morbidity and mortality. The measles virus, or also known as MV, is spread through the air and causes systemic illness. The discovery of novel cellular receptors and investigations in animal models have challenged the traditional measles pathogenesis theories throughout the last decade. So, measles virus is hypothesized to enter the host through the airways where it infects the alveolar macrophages and or dendritic cells. And then, it multiplies in local lymphoid tissues. The viral replication caused by infected CD150 plus cells spread throughout the body. The recently discovered receptors, which is the Nectin-4, it enables the basolateral infections of epithelial cells by infecting lymphocytes and dendritic cells in the pulmonary submucosa. The continuous and widespread epithelium injury may help the following host to transmit the virus efficiently. Measles sign and symptoms. Measles symptoms appears 7 to 14 days after the contact with the virus, and it typically include high fever, cough, runny nose, rashes, red and watery eyes, and sore throat. Measles rash appears 3 to 5 days after the symptoms begin. Measles isn't just a little rash. Measles can be so dangerous, especially for babies and young children. Measles typically begin with tiny white spot or also known as the Copic spot. It may appear inside the mouth 2 to 3 days after the symptoms begin. And then, 3 to 5 days after the symptoms begin, a rash breakout. It is usually begin as a flat red spot that appears on the face, at the hairline, and spread downward to the neck, trunk, arm, leg, feet, and small raised bumps may also appear on the top of a flat red spot. The spots may become joined together as they spread from the head to the rest of the body. When the rash appears, a person's fever may spike to more than 104 Celsius or Fahrenheit. Measles laboratory diagnosis. To confirm a case of measles, your healthcare provider will likely run some blood tests and take either a throat or a nose swab test. These tests detect the virus specific indirect immunoglobulin. It is an antibody that is usually present about 3 days after your rash appears. The antibody may not show up before then, will generally peak at day 14, and is usually gone about 30 days after your rash appears. You may also have a urine sample taken since the measles virus can be present there as well. And if you suspect that you have a measles or have been exposed to someone with measles, contact your doctor immediately because they can evaluate you and direct you where to be seen or to determine if you have the infections. Also, doctors can confirm measles by examining your skin rash and checking for symptoms that are characteristic of the disease, such as the white spot in the mouth, fever, cough, and sore throat. And if they suspect you have the measles based on your history and observation, your doctor will order a blood test to check for the measles virus. Measles treatment. Getting vaccinated is the best way to protect yourself or your family against the measles virus since wala namang gamot para dito. 'Di ba may paniniwala yung mga matatanda noon na once na nagkaroon ka na daw ng measles or tigda sa Tagalog is hindi ka na raw magkakaroon ulit. Pero according sa WHO or sa World Health Organization, kapag nagkaroon ka na ng tigdas is mas malaki yung chance na magkaroon ka ulit nito for the second time since na-immune na yung katawan mo sa virus. And para maiwasan ang pagkakaroon ng measles virus is number one talaga is kailangan talagang magpabakuna. Since as I said a while ago, wala namang gamot para dito. Or kung ayaw mo naman na magpa-vaccine dahil takot ka sa pwedeng maging epekto nito, mas better na magstay ka na lang sa bahay as much as possible. Or kung lalabas ka man is magsuot ka ng mga PPEs or like mask and always sanitize and also um, drink vitamins para maging healthy and strong yung katawan mo.